Well, good afternoon, everybody. So this is the Wednesday 3 p.m. Facebook Live. So as I've been doing every day, I like to kind of go through statistics, both globally, US, and then the state of Ohio, and then I will take all your questions. And in between there, I'll give you some interesting news. So unfortunately, total cases globally continue to go up. So we're at 451,000, which is another increase of 44,000 in the last 24 hours. China really has hit their peak, and I want to talk about something that I haven't talked about in days prior, which is the number of deaths in the country, because I think there's some interesting things to learn from this. So China has 81,000 cases, and they had 3,200 deaths. Italy continues to be in crisis mode, so they are up to 75,000 cases, which is up another 11,000, and they have had 7,500 deaths. So with a population much smaller, obviously, than China, and about equivalent number of cases, they have double the number of deaths. And so this is just horrible news. Spain continues to increase. Now Spain is behind the US in terms of total numbers. US is third. But again, looking at the mortality and the rate of increase, it's really concerning. Spain is up to 47,000, up from 40,000 yesterday, so a 7,000 increase. With that number, though, they have had 3,400 deaths. And again, when you compare that to China, which had 81,000 cases, not 47, and about the same number of deaths, it's very, very concerning. So what's going on in the US? So again, cases continue to rise. We are at 60,000 total. And I want to compare a little bit about the number of deaths we've had, because we've only had 849 deaths out of that 60,000. But what I want to mention to you is that all of the other countries are reporting the number of cases of people that have recovered, and they are far larger than the number of deaths. In the United States right now, we're only reporting 354 cases of people who have recovered compared to the 849 deaths. And this is, I want you to think about, because we're still early in this pandemic in the United States, right? So this is a relatively long infection, upwards of 2 weeks. Hospitalizations can be on the order of 14 to 25 days. And so again, we're kind of right in the middle. So we don't have the same number of people that have recovered, and we do have a reasonable number of deaths already, and that number clearly is going to climb. It is one of the reasons when you look at this upside down cases recovered to number of deaths, the reason that I think President Trump's statement that we're all going to be back to normal on Easter Sunday is misguided. It's too early. We really have much longer a longer time frame that we need to think about with our social distancing and what we're doing with stay-at-home policies. So New York is the epicenter of what's going on in the United States, and it continues to be grim. They are up to 31,000 cases. Again, huge. So of our total 60,000, just in New York State alone, they're more than half. Again, this peak looks like it's going to be very high, and it's going to come in the next 2 to 3 weeks. And really the estimates continue to be about 140,000 hospital beds will be needed, and they only have 50,000. And so they're on this mass build now of external hospitals that they can use for the patients who need hospitalization but don't need ICU care. And this is happening across the state very quickly. Of the 31,000, New York City itself has 18,000. And really, when you think about that, that is just an enormous number in a very small area, and very, very concerning for the impact that it's going to have on the health systems and the hospitals, and the lack of capability that they have. Ventilators are continuing to be in very short supply. There have been some movement, apparently about 4,000 of them from the reserve, the Federal Reserve, of ventilators. But again, according to the governor, vastly inadequate. They're not even close to having the 30,000 that they anticipate needing. So this is all hands on deck. This is really a crisis mode in the state of New York. And again, I think it portends that potentially our wave here in Ohio, which I'll talk about, is yet to come. And the hope, of course, is that we've done a good job with our social distancing earlier than New York was able to start doing it, or knew to start doing it. And so that our peak and the magnitude of our cases and the number of hospital beds and ICU beds that we'll need will not be as great as it is in New York. I will mention that the FDA did come out yesterday and approve the use of serum from previously infected patients so they can get antibodies to the coronavirus for patients who are close to death, for those very terminally ill or very severely infected patients who look like they're going to die, to attempt to give them antibodies to see if they can help them recover. So what's going on in Ohio? So our governor did his daily kind of update at 2 o'clock. A lot of information from that. We are up to 704 cases in the state of Ohio. So again, compared to New York, very small numbers, but that's because we're lagging behind them. This is up 40 cases from yesterday. What's interesting is the data still skews to men, although it's equaling out. 333 females in that group, 371 males. So it's 47% females, 53% men. And that is consistent from the data in China that there is a male predisposition. Of those, 182 have required hospitalization, which is 20%, which is a little bit higher than what we were seeing, and 75 of those patients are in the ICU, so that's 11% of the total number, and that also is a little bit higher than what we were seeing from China. We had 4 more deaths overnight, so 10 deaths now, which when you look at numbers just for our state, not for the whole population of the US, but we have about a 1.4% mortality rate. What's important to know is that 116 healthcare workers have been infected, and these are the people on the front line. The other important thing to note is 70% of cases are in people over the age of 40. So again, this is affecting across all ages. There's now 1 case in a child less than 1 year old, all the way up to 99. But what we do know is that there is a large segment in the 40 to 60-year-olds that are becoming infected, and actually in the 40 to 50-year-old group, the case fatality is 1 in 250 people, which is a fatality rate of 0.4%, which is quite high for even in that younger population. Testing across the state has increased, although it's still way behind. There's about a 5% positive rate in the testing that has been done in the state of Ohio. Governor DeWine does not anticipate, giving up on the stay-at-home order in the near future. And I think everybody's continuing to watch what President Trump and what we are going to do. But I think I saw something from Vice President Pence today stating that they have no plans to do anything from a federally mandated stay-at-home policy, which personally I think is a mistake because we travel between states. And, again, I'm not sure if we look at what happened in Italy, we can be sure that, just by states doing individual things that we will contain this. Okay, a couple interesting things that have come out in the last several days. Interesting one is that now there's pretty strong data, actually in about 30% of patients that are infected with coronavirus, that they lose their sense of taste and smell. And it's poorly understood what the mechanism is, but it's really being added to that symptom, to one of the symptoms that's associated with coronavirus. There is some good news from basic science about this virus. It continues to look like it does not mutate very much. Okay, so what does that mean? So we know influenza. You probably know the flu vaccine you have to get every year. Why is that? Influenza mutates very rapidly. And so every year we have to kind of develop a new vaccine that is targeted to the mutated type of virus. And this is why some years the virus continues to mutate. The vaccine is more effective than others. What's great about COVID-19 is that it appears that it really is not mutating at all, which means that developing a vaccine that has long-term benefit in terms of increasing antibody levels and offering protection is really likely to be able to be developed in a very different way than the flu vaccine, which needs to be changed every year. You may have heard, because this seems to be the fact that people have heard, is that Prince Charles has COVID. I looked to see if I could get a sense online. They're obviously being very protective of the data of whether or not he's quite ill. Apparently he just has a cough and he's doing okay, but of course we don't have any real information about that. He is 71, and I'm sure that they are really being very concerned about the Queen. Okay, at-home testing. I mentioned it yesterday. So the startup companies in the space that really worked hard to launch this, Nurix, Carbon Health, Everlywell, they continue to just, on their websites, all say that they're not offering testing at this time. Again, this really, they launched it and then pulled back because of the FDA's concerns about it not being a validated testing, and because of concerns of, not appropriate tests being sent to patients that have absolutely no benefit. What is really interesting is data from the UK today. They actually look like they've developed a completely new novel type of test that looks like it would be a device that you could have in physician offices that's very inexpensive. And they were citing in here that the device itself would cost around $120 US, that the materials needed, the swabs to run the test, only about $5, and that the test would give results in about 30 minutes. Of course, this is in the UK. We do not have this here. It's a completely different test than what's being run right now. And so I don't know where this will go, but certainly, promising for the future. Okay, so that's my update. Let's see if anybody has any questions today. So I do not see any questions today. Let's see if anybody, okay. All right, people, anyone have any questions for me? Because if not, I will let you go after 10 minutes. I hope they're coming through. All right, well, I guess no questions. I will tell you that my husband is going to join me again tomorrow for this. He obviously being an emergency room physician and really on the front lines will have lots of great data about what's going on specifically in Cincinnati in terms of testing and cases. So I hope you'll come back tomorrow and ask him a lot of questions. And finally, I just want to say, we are still continuing to see patients with urgent health needs in the office, and we do still really want to be available to you, our patients, both via telemedicine and in the office. Again, we are doing everything we can to protect patients that come to the office in terms of making sure that things are clean and that patients are really segregated, anyone that has any concerns about illness. But please remember, we are trying to stagger it so only one patient is in the office at a time. So please make sure you call and schedule with us before just showing up in the office. But again, I want you to know that we really are open and we really are trying to take care of you. I also would just say, again, if there are individuals who are sick and don't have access to a primary care provider and are looking, we are able to selectively, slowly take new patients now as well. What we would do is start them via telehealth. Again, do an extended visit like this via video conference so we can establish a good database. And then certainly when the office is really at full capacity, or if you have an urgent health need that we think you need to be seen, we would bring you into the office. So again, please reach out to us if we can be helpful, and please come back tomorrow at 3 o'clock and join me for an update and ask my husband questions. Thank you.